So ulcerative colitis. Generally, in practice of medicine, it has been told that it is incurable disease. It has been declared in the practice of medicine, generally the idiopathic, the disease is generally idiopathic. And this idiopathic ulcerative colitis generally has no treatment except some palliative measures. In homeopathy, we have enough scope to treat such cases, and I have cured myself many such cases, my friends. Now, I have already told in many of my videos that ulcerative colitis is a chronic inflammatory bowel disease. Inflammatory bowel disease, especially of the large bowel, which cause ulcerations of the mucosal membrane of the rectum and upper part of the rectum, and also can involve the whole colon of a human being. The cause is generally unknown, so sometimes nowadays it is called idiopathic ulcerative colitis. Pathologically, the mucosa of the rectum or affected part becomes very much red and inflamed and ulcerated. The ulcer begins very slowly, gradually and insidiously. The patient cannot understand at the earliest stage whether he would be the victim of an ulcerative colitis patient. The main symptoms are chronic bloody diarrhea with watery stools containing mucus. The stool may be as frequent as 10 to 20 times per day and may contain entirely blood and pus, and may not any fecal matter. Abdominal colic sometimes accompanied diarrhea. Abdominal tenderness, malaise, lethargy and anorexia may be found. And another important symptom is weight loss. Day by day the patient becomes deteriorating her health, and weight loss is a common symptom turns. In a severe case, the patient becomes toxic and anemic with severe weight loss, fever, and with features of acute abdomen, with peritonitis. One peculiar characteristic symptoms of ulcerative colitis is there may be relapses and remissions of signs and symptoms again and again. That for that the patient thinks he is cured. রোগী মনে করে আমি ভালো হয়ে গেছি, but very soon the symptoms all relapses. Emotional stress, intercurrent infection, gastroenteritis, large numbers of taking antibiotics and NSAID, etc. may provoke the relapse. There may be massive life-threatening hemorrhage, severe erosion of the mucous membrane may lead to perforations of the colon and peritonitis. If not well treated and cured, after many years, the chronic ulcerative colitis may give rise to carcinoma of the colon. So this is about ulcerative colitis. This is the gentle lady has been suffering from ulcerative colitis, for which she had treated with EIG, the prestigious Institute of India of Hyderabad. And they have treated accordingly to their own choice of mode of treatment, but without any result. The patient is not improved. উন্নতি খুব একটা কিছু হয়নি ট্রিটমেন্ট করে। তাহলে আমি চোখের সামনে রোগীদের দিয়ে দেখাচ্ছি যে অ্যালোপ্যাথিক চিকিৎসা করেও বহু কেস রোগীরা ভালো থাকছে না। একটু আগেই একটা পিটুইটারি ম্যাক্রো অ্যাডিনোমা বলেছিল টিউমার অপারেশন করলে চোখের দৃষ্টি ফিরে পাবে, বাট হি ডিডন্ট গেট দ্য ভিশন। চোখের দৃষ্টি ভালো হয়নি, তাকে আমি পালসেটিলা দিয়েছি অ্যাকর্ডিং টু সিমটম সিমিলারিটি। Now this is the case also required pulsatilla because thirstless. Our patient is totally thirstless. The urging of stool aggravates after eating, irritable temperament, but that not last consolation, amelioration the patient. So, considering the mild temperament and thirstless, in homeopathy, the medicine differs from one individual to others, as we not treat in general way by the mode of generalization, but in the individual way by the mode of individualization. So individualization is a mode of treatment of our homeopathic system of medicine. Now another symptom, if we go through the case repertory, diarrhea, stool, urging, aggravates eating after, etc. is in the first grade. খাওয়ার পরেই স্টুলটা বাড়ে, পিপাসা কম বলেছ, থার্স্টলেস, রাগ হয় কিন্তু একটু বুঝিয়ে বললে কমে যায়. So irritable temperament but consolation abrogates and thirstless, and the stool aggravates as soon as the patient goes to the toilet or latrine, after eating. As soon as the patient takes food, there is urgency of stool. So all symptoms, but there is contraindication, the tongue is moist. I do not bother my head, Jib Dakhan. The tongue is not totally dry. It is like dry, but not totally dry. Matters little to me. The general symptoms, thirstlessness, and the mental symptoms, mild temperament and consolation, amelioration, and the peculiar particular diarrhea, urging of diarrhea aggravates as soon as the patient takes some food. Consider me to think of pulse. So pulse is the choice of medicine, my friend, and I do like to prescribe pulse in 50 millisievert scale of potency. Once again, it is a challenging case, and I have accepted the challenge because the patient has written from EIG of Hyderabad. These are 50 millisievert scale of potencies. অনেকে জিজ্ঞাসা করে এটা কি ওটা কি, কিছুই না জানলে, কিছু পড়াশোনা না জানলে এই সমস্ত মূর্খদের প্রশ্নের উত্তর দেওয়া আমার পক্ষে তো সম্ভব নয়, দিই না. These are 50 millisievert scale of potencies. Hahnemann denoted 0 means globule. It is not 0. That is globule by 1, globule by 2, globule by 3, etc. So in short, we may write only 1, 2, 3, 4, 5, 6 of the 50 millisievert scale of potencies, because these potencies are chance of less aggravation, mildest in reaction, and more dynamic than centesimal potencies, which discovered Hahnemann in his later ages. So let's see the result. I shall share with my friends the result of this case. Stay with me, stay with my YouTube channels.